As doctors, I mean, we cannot see a patient every month or every week to see if their AFib comes back. So that's when something like the AfibAlert comes into practice, because you may not see a patient for 3 months or 6 months, and you will have no idea whether their AFib came back or not, unless you have home monitoring like this that they can do, and then they'll notify you. So it's very important insurance-wise. I mean, you really cannot justify bringing patients back, very frequently to check to see if their AFib comes back. So again, this device has a very specific role for patient safety and to notify you if there's a problem. And so it's a very good device that saves money for insurance companies and I think increases patient safety greatly. I had a patient about 3 or 4 weeks ago that just got an AfibAlert about a month before. He had been in normal rhythm for I'd say 4 or 5 months. Had sinus bradycardia, rate in the 50s. He felt very well in normal rhythm. He was on amiodarone, which is, I would say, the strongest medication that we have for that. I really had no concern that he was having AFib at all, and we stopped his anticoagulation several months ago. And so he got the AfibAlert. I did recommend it. And then about a month later, when he comes back on his visit, he said, "This thing must be broken." He goes, "It's reading red." So he had downloaded these strips, and he indeed had atrial fibrillation. The device said red, and he had AFib. And he was in normal rhythm when he came back to the office, but he was having long episodes of AFib that we had no idea about. He was on the strongest medicine that we have for AFib. So we did restart his anticoagulation. I do feel like that device in that particular instance saved his life, and that's, I see this routinely. So, I think we do, you can really go two ways as an electrophysiologist in certain respects. You can either have patients on anticoagulation forever, just knowing that their AFib is going to come back at some point, or you can stop it too soon and the AFib may come back and you don't know it. So, this device really helps with management, really changes the game and how you can manage patients with AFib.